So thank you all for joining. Today is March 18th. The topic is women's health and wellness as it pertains to seniors in our community. And for those of you who are not familiar with the Community Connector, we started the Community Connectors a year ago to this month. So it's been a year that we've been doing the Community Connectors. And we started them initially to keep the Washtenaw County community and the elder care services connected, engaged, and informed during this time. Every month we have about 4 to 5 speakers with different topics, and we have them on with an opportunity to educate our participants about their services and how they have worked through the pandemic. So we do encourage Q&A. If you can put your questions in the chat feature, we will address them after the call. And without further ado, I will turn it over to Brianne.
Thanks, Pandora. Appreciate that. Yeah, we have a great lineup of speakers today. We're super excited about all of them. We have 5 speakers today, and really they're just going to address women's health and wellness, specifically elder women's health and wellness. And really kind of like we have had the same theme of what has it been like in isolation? How has the pandemic and COVID affected women and their health, the stay-at-home lifestyles? We've seen this as such a challenge. How has it specifically challenged women's health and wellness? And of course, we always open it up for any other discussion that our speakers would like to discuss. And we have, like I said, we have 5 speakers. Our first speaker today is Paula Michalak. She is the program director for the Women's Center of Southeastern Michigan. And I'll hand it over to you, Paula.
Thank you, Brianne. So at the Women's Center, the thing we hear most often in the community is, I've never heard of you before. We're a small nonprofit. We're 21 years old this year. And we've continued to work throughout the pandemic. The administrative staff has been coming into the office. We're mostly older folks who don't have much of a personal life, so we're pretty safe. And now we've all been immunized, so we're excited about that. And our therapists and our other staff have been working remotely throughout this time. And as for most people, like, that was a huge challenge initially to jump from in-person services to online services. And we continue to offer all of our services. So we're a mental health facility. We see people on a sliding scale fee. We have master's level interns who are with us for up to a year, who work with the sliding scale community. And then we also have fully licensed therapists who see people who have and are able to use their insurance. We have job coaching, we have financial coaching. We have a mom and baby group. We have a Black mom and baby group. And we also have divorce education and support. I'm not sure where you make the cutoff for elderly or older adults, but I turned 65 myself this year. That was, I don't know. I was hoping there was like a Turning 65 for Dummies book because I needed it. One of the things that we offer to the community is we do resource navigation. So for services that we don't have ourselves, we help clients find those services, whether that's food or physical health or housing. Housing insecurity is a huge problem in the community, and older women often arrive at housing insecurity through divorce. I'm the divorce facilitator for our online divorce support group, and that is a real concern for older women who may not have financial support, who are looking for housing. So that's been a real scary thing for people during the pandemic. Lots of people's relationships. So during the pandemic, people's relationships, some have grown stronger during the pandemic, and some the wheels have fallen off the cart. And women are sometimes trapped at home with sometimes abusive partners. So we try to support them in every way that we can. I think one of the challenges that we've seen is that remote services have increased the accessibility for some people. And then we have some people who are seeing us out of their laundry room or their car or their bathroom because they don't have privacy. So the pendulum sort of swings between women who live alone and who are struggling with connecting with folks, or women who are living with too many people and are exhausted from trying to manage so many different needs. And women are usually the caretakers for others. I have older women amongst my clients who are still caring for elderly parents in their 90s. And so they're sort of caught between trying to support their kids and trying to support their parents still while navigating their own health and well-being. Although we're a mental health facility, we see physical health and mental health as connected. And social support is such an important piece of that mental health. And so encouraging women to reach out and to be intentional about connecting with friends and participating in community things, book clubs or educational things as they're able. The women who are most isolated are the ones who don't have access to laptops or smartphones. And for them, it's a real challenge to stay connected in the community. I'm trying to think. One of the things that my 5 suggestions for optimal health and wellness during we always encourage people to take a walk if you can and get some exercise if you can, because it's to eat as well as you can, and to not have unrealistic expectations. I don't think when we started this, anyone imagined it would go on for as long as it has. And just maintaining and not having unrealistic expectations about how good you're going to feel or what you're going to get accomplished when we've essentially been feeling like we're chased by a bear for a year now. So I do see some hopefulness with people who are getting the vaccine and feeling more comfortable about being able to see their grandkids or their friends or their coworkers. For us, we're looking forward to having our coworkers come back into our space and being able to see people in person, because we think that in-person connection is such a vital part, particularly for women who value their communities and value the social support in their lives.
Well, thank you, Paula. Anything else you'd like to share with us?
Not that I can think of till later.
Yeah, no worries. Well, I love hearing that you all have been in business for 21 years. I had no idea myself, and I've been on your website quite a bit over the last couple of weeks. And that's an interesting point that you brought up about women who either live alone or, exact opposite of that, overwhelmed with how many people are in their environment. So that's a really good point that you bring up. And it's something that I don't know if I've ever considered, especially as we're working with our clients and folks. So it's something that I know that we'll consider now. Absolutely. And then, great suggestion about being intentional about connecting. And making sure that all of us are intentional. And we have heard that on a few of our other calls is not only the person that is potentially suffering being intentional, but also us as a community and as a support system, making sure that we're intentional about reaching out to our loved ones, our family, our clients, all of that. So great point, Paula. I really appreciate it. And thanks for joining us today.
Sure, my pleasure.
So our next speaker is Emma Green. She's the Practice WOE Manager and Women Advocacy Program Co-Director for the Women's Safe Health. And so I believe she's still on with audio. Uh-oh, we're having audio issues again. Oh, there we go. Yep, can hear
Good.
you.
Okay. Perfect.
Wonderful. And I'll hand it over to you, Emma.
Okay, thank you so much. So yes, practice flow manager has always been a really fun term we all get to use. Everyone's always surprised the first time they hear that. That and co-directing our newer advocacy program the last 2 years, which has been really interesting too. We're getting ready to hopefully launch our training program for women advocacy this December. The first year, which was 2 years ago, we did pretty well with it. And then when the pandemic hit, we realized, wow, we already knew that there was a need for this, but this has really increased the need for so many reasons. But we do a broad range of services, everything from in-person medical appointments to just weekly and daily check-ins with various clients in the community. I know we worked with you guys last year for a specific client who had a medical procedure, and we don't typically do overnights, and it was amazing that we could just call on you for assistance with that, and our client just had such an excellent experience, so that was great. But yeah, one of the things we've kind of run into is that we typically aid people who are apprehensive about having in-person care as it is, like pre-pandemic. So we've kind of had to shift everything, like most, models have, that we now sit in with people for virtual appointments. Because to a certain degree, being in a medical setting and being considered essential workers, we've always just continued to stay masked up and show up and still be present for people who are comfortable with that, which has been huge. We have had certain challenges in that we do work with multiple facilities in the community. And, when you can't be in the building now, or, all things of this nature, it's definitely made things more complicated. But I loved the conversation we were just having about really trying to ensure connection still, and kind of helping the elderly folks in our community as well get comfortable and get acclimated with virtual care, essentially. A lot of them are not tech savvy necessarily. My mother is a perfect example. She has Alzheimer's. And so, as advocates, we do everything from help build schedules and coordinate time with family members and community, to be online, FaceTime, and a set schedule with people to make sure they're not feeling isolated. Just coordinating care across the board, both in a medical and non-medical setting, to sort of integrate that care and keep everybody having open dialogue and on the same page has been really important for us specifically. We have had clients, I wanted to bring this up just because it's kind of been a thing for us since we've been approved by the CDC to have and administer the vaccine, but we have not received it yet. That we have elderly folks in the community, and it really is almost like a 50-50 down the middle split of folks that are actually nervous and apprehensive about taking this vaccine, and others who are really eager, like you mentioned previously, just to see family and grandchildren in person. Again, I think my mother has been out of the house at all, aside from walking her dogs alone, probably twice in the last year, and that's just so rough, for everyone. So we've got that. We work with people to build systems with, text, phone, in person. The combination of that, checking in on people regularly, is so huge. I think that one of the things we've really enjoyed in the last year specifically is coordinating with family members that can't be there. We have folks with immune disorders and issues that can't be there for their parents, aunts, uncles. So we assist even in situations like that, where we're willing to go and we're masked up and we go and kind of handle that care. Lifestyle changes have really impacted healthcare for them, like within our office. We are such a tiny model. It's just Dr. Elizabeth Shadigian at Women's Safe Health. So, we have a person that cleans our facility thoroughly every night. We have taken every safety precaution and measure to make sure that our space specifically is sanitized and really safe. So I think it's been encouraging for our community to still come into our building specifically. Oftentimes, we are the people who are trying to reroute folks who may have wound up in the emergency department or the ER at St. Joe's or U of M, who really are terrified to be in a giant institution during these times. So, we have done everything from like IV fluid and just letting people rest in our office. Again, tiny office, one physician, to administering meds, so on and so forth. But we really tried to be a hub for the elderly folks that just still do not feel safe going into larger institutions. So that's been really interesting. But yeah, we're really excited about launching this program, looking for advocates, wrapping everything up. Even that will be done for the greater portion virtually. And the idea is to bring on advocates and local people in the community from Ann Arbor to Detroit to train them our method and our business model, which is compassion-based, trauma-based work, and then, turn them out into the community under our specific model. So the majority of that training even will be digitally and online and accessible. We're really looking forward to that. But one of the things I get to do as the co-director is pair our clients with advocates, which is great because then you can really kind of do these fabulous custom fits for people. We get to take the time to know our clients. Again, when we called on you guys last year, we just had such a rave review. She was so happy. And it's just so important to us as a model to make sure that our elderly community specifically, feels like when their children or extended family members can't be present, that we sort of like step in, right, and serve that purpose for them. So yeah, it's kind of where we're headed at this point.
Good. And is there anything else that you'd like to share? Any suggestions on optimal health and wellness during these times?
One thing that just kind of popped up for me just in you asking that, another thing that we do too is sort of like a nutritional counseling. And I know that sometimes access for folks at home is not as good as it usually is, obviously. We've even done things like menu planning and setting up Shipt for People, Instacart, meal prep, where we're actually in home or we prepare outside of the home and take it to them to make sure they're really eating well. Because I think that in times like this, it's a lot easier to like click a button and have someone drop off something that's like fast food or it's, whatever. But with them being isolated, I have found that, the services we provide around both, the grocery shopping end of things and making sure they're eating really healthy foods, but also having them prepared and actually taken to the client is really helpful in terms of health right now. We do like prescription drop off and pick up for clients too. So for those that aren't using like PillPack or, mailing out of their prescriptions, that's another service that we do for people, that we actually physically take in their prescription and deliver it to them by hand. So yeah, there's always more, right?
That's wonderful, Emma. And I'm really looking forward to hearing a little bit more in future days or months about your approval of administering the vaccine. On that follow-up, do you think that this will be something that you'll be administering within your office or going directly to the homes?
This is going to be in our office.
Okay.
We've even discussed, because we're such a small practice, the same way that major chain pharmacies have set up like drive-through service, we could very easily do that with our like physical setup. It would not be difficult to do. So even those who aren't comfortable coming into a building at this point would still be able to have it administered like in a drive-by scenario.
Okay, wonderful. And I love hearing about the just trying to be a hub, trying to just break down boundaries and being, there for whatever someone needs, because no one's cookie cutter, and everybody has specific issues that they're dealing with. So I just can't thank you enough for just bringing us up to speed on what you guys have been doing and what's been going on. So thank you so much, Emma.
Absolutely. Thanks so much for having me.
Absolutely. So our next speaker is Karen Montz. She's the practice manager of counseling services at Arbor Hospice. And Karen has frequented our community connector a couple times, and just a wonderful advocate. So go ahead, Karen.
Thank you. Thank you again for having me. I love coming to talk about all things our community, our Washtenaw community, mental health needs, and learning from everybody. Thank you, Paula and Emma. That's a wealth of information. I love coming to these because there's so many organizations you don't even know about, and the great work you're doing. And we do work with our bereaved, of course. I'm with Arbor Hospice. And so we primarily provide, well, let me give you two of my hats. One of my hats is practice manager of counseling services. So I get to really oversee the practice of social workers and our spiritual care advisors for hospice in the work that they do. So every patient that comes onto the program will receive a visit from a social worker or a spiritual care advisor, unless they just refuse. But we want them to accept, and so that they can get out there and they can have a wide array of counseling services. And then they also may be offered a grief support person before the death, but at least after, they'll get grief counseling for a minimum of 13 months after the loss. And our support is extended outside of our families to the community. So anyone in the community who has experienced a loss, a significant loss, is welcome to attend our support groups. And what do I mean when I say significant? And for the older person, it is what they define as significant. The significant could be the neighbor down the street who, you had coffee with every single day. That's significant to you, is significant to us. So if any significant loss, they're welcome to attend. And there, of course, is no charge. We do, of course, like most organizations, nonprofit, accept donations, but that's what we do at Arbor Hospice. So let me dive right in. How has women's health, these are some great questions. How has women's health and wellness suffered during these times of isolation? Wow. Well, Paula and Emma have already brought up some great points, but I want to speak from the perspective of grief and loss. As we know, most of our bereaved have lost a spouse. So you're dealing with an older person. They've been married 40, 50 years. We do have people who've lost children, older people who've lost children, older people who've lost siblings, and friends that are on, that become a part of our bereavement group as well, or attend our groups. But I think the critical thing that has happened is our older bereaved, how they have coped in the past is getting out and about and seeing their grandchildren. You hear a lot of them say, I get to take the grandchildren to school. That's what I look forward to. I've heard a lot of men say to me, I take my daughter's kids to school. That's what I look forward to every day. And, a lot of times that's exactly what the children do. They help to give the grandparents some sense of purpose. So I need you to, and not making it up, but I need your help. So come and take the kids to school. Come and help me with fixing the house. But as we know, they haven't been able to do that. They have not been able to do that. They haven't been able to go and spend time with the grandchildren. They've been isolated. We know many times older people, if they live in a senior apartment building, they've pretty much been sitting in that 1-bedroom apartment for the last year, not coming out much. And for a long time, they could even have visitors. So we know isolation, this extreme isolation, has taken a mental health toll on especially our older bereaved. We know we've seen the COVID-19, in other words, the COVID-19 pounds, weight gain, because people can't do the things that they usually did for self-care, can't go to the gym. People were even afraid to go outside and walk. So a lot of the things that you did to cope with grief and loss, you could not do. You couldn't come to a support group. We have a lot of older persons look forward to that monthly group. That's what they look forward to, at least being able to come to see the people that I see regularly. And for a while, they did not want to do the virtual. As Emma has shared, they were not comfortable with that virtual. And so it really was a learning curve. How do you get people interested in this virtual? And I can remember one situation where there was a particular group of people, mostly older, and they switched over to virtual. And there was a few of them that didn't come, and people missed them. So the grief counselor reached out and said, hey, join by phone. Let me teach you how to do that. And they were able to do that. And so I think really this grief during the isolation. The other thing is, a lot of times we tell our bereaved, you have to go and get a health checkup. You need to go and get a health checkup, because as you know, if they've been a caregiver for 5, 6, 7 years, they've been taking their loved one to the doctor, but not themselves. So their own physical health has been challenged. And when that adrenaline drops, when I'm not getting up at 6 o'clock, getting him his medications, get his breakfast, get him to the doctor's appointment, come back, do the lunch. When that drops, a lot of times that's what you find, right? Their immunity may drop. So you find older people start having all kinds of physical challenges. Well, we know what happened. They couldn't go to the doctor last year. They couldn't go get a health checkup. Couldn't even go and get a routine teeth cleaning. So, that's how the health and wellness, I think, really suffered. And those things are so crucial for somebody who's grieving. And I think that made it particularly challenging. The positive that we have seen in the delivery of care is the fact that we were able to, of course, switch over to virtual. And I believe our older persons are becoming more comfortable with the virtual. It'll be interesting when we go back to face to see how many will want to do the face-to-face. We've already decided to keep a hybrid model, because we know that there will be people who won't do face-to-face. So I think that is probably the most positive that is coming out of that, is that people are getting used to technology. Time will tell if that's a negative also, that we can't get people to come in face-to-face, because now they've gotten used to this. But what we've found is that more people have joined our group than more people have stopped. So we've got a lot of new people in our groups. It's interesting, some of my counselors that are in other parts of the state, because I also have Hospice of Michigan as well. And some of our counselors in other parts of the state, they will call me and say, they'll let me know many of the people that are attending their group are Washtenaw County, Washtenaw County persons. So that's interesting. Like, that time and day works for them. And so I'm so glad they're able to do that. I think that's a positive that has come out of this. How have stay-at-home lifestyles changed? Again, I think there, especially when you're bereaved, you need to be able to go to gym or walk, so you can't go to the gym. There's a lot more anxiety and fear, and you're just vulnerable. And so I think the stay at home has also created unique opportunities. And it's interesting to hear people say some of the things that they're doing to help to adjust. even we have to learn, how do you decompress at the end of the day? I don't have that time where I can shut the door and go home, and so I think a lot of our older persons have really thought about that and really engaged some new activities to help them to cope with the challenges. And man, the vaccination, I guess, as I think Paula and Emma said, all I keep hearing is, I get to go see the grandchildren. I get to go see. That is the resounding remark I am hearing, that I get to go and see the grandchildren. The grandchildren bring you life. And so I'm excited that they're able to do that. People are ready to come back for groups and the one-on-one and the home visits. So my top 5 suggestions for you for optimal health for our clients and also for us is self-compassion. People were really fighting themselves because of depression and anxiety, but we got to maintain this self-compassion, see a counselor, continue connecting, do self-care, and journal. And don't forget to decompress.
Thank you so much, Karen. And it is great that you brought up the fact that people were coping in a different way before. They had a purpose. They were connecting with other people outside of their homes and have had to shift their coping skills, which is a great point, because not only are they dealing with a death in the family, but now they're doubly dealing with extreme isolation, which is absolutely devastating, and is going to have some effects here in the future. But thank goodness we are getting vaccinated here. We've got some hybrid solutions. I love that you guys have that hybrid model coming down the pike, because we found from all of these calls as well that it has helped people with access issues, like if they can't drive or anything like that, but it's also caused some isolation as well. So having both available to people is absolutely key. And thank you for your suggestions. Those are great, especially the journaling. I know I've been doing a lot of journaling this year and just trying to stay sane during all of this. So thanks again, Karen. Appreciate it. And next we have 2 speakers, Tabitha Mullins and Karen Valdivia. She is the Senior Clinical Quality RN for United Healthcare. And they're going to tell us a little bit about what they've experienced with older adult women, health and wellness.
Hi, everyone. I'm Tabitha. I'm the Community Outreach Specialist for the Government Programs Division of UHC. Some of you might already be familiar with me or have seen me back in the day when we could actually do physical meetings in Washtenaw County and older adult meetings. I miss those. I miss the bagels. My body's okay with not having them, but I miss them in my soul. In any case, I just wanted to give a little update and a little bit of a reminder, just to update you with what we're doing right now in the field with the community and on the ground with older adult populations. UHC has a major focus on social determinants of care. So a lot of the events, programs, and things that we support in the community try to have a focus on those social determinants. A lot of what I do focuses on the senior population, homeless population. I focus heavily on the Medicare and also the Medicare-Medicaid dual population. And with that being said, I'm sure most of you already know that dual population aren't always seniors. They're very often probably between 30 and 40%, depending on the county, depending on the area, are actually younger adults that have aged into Medicare early because of years on disability. Which can be a very strange and new transition for a lot of people. Like Paula was saying a little bit earlier, there's not really a roadmap. I was just at an event at a senior tower in Detroit yesterday, and we had a woman come in and say, I know you're out here giving out green donuts for St. Patty's Day and giving us PPE and sanitizer and all of that, but I actually have a question for you because I just received this letter from the Medicare office with my Medicare card. I don't know why I'm getting this. I'm only 50. And we were able to help her determine, well, you aged in early because of, being on disability for a number of years. We deal with a lot of that, especially in our homeless population that don't have stagnant housing. And it's hard to, follow up with, making sure you're recertifying for Medicaid or getting your information for your Medicare if there's not an appropriate address for you to receive mail and things like that. So obviously the programs cover a variety of things. It's obviously health focused, the dual program. So it covers, dental, vision, chiro, hearing, all of that. But we also have, over the counter benefits as well as healthy food initiatives. And all of our members get member care navigator access as well that help them, do those pre-screenings, make sure that they have access to transportation, schedule transportation for them to their appointments. So we try to do as much as we can to be a resource, but also connect people to resources. And I think someone echoed this earlier. Sometimes it's just a matter of there are these organizations available that have the resources. It's just a matter of finding that. And it's very clear that the most vulnerable of our population really lack the access to that information and getting it. And, even for people who are very privileged and very savvy, still seem to have, issues, just locating, resources and all of that. So we're here to help as much as possible. I would like to say before I hand it over to Karen to get to, what you really came here for, is just to let you know that currently, we are in the field doing community outreach events and support. Right now, our focus a lot is on vaccination events. Right now, we're working with Access Health. We're also working with DABO. We're working with Honor FQHC in Oakland County. They've got about 19 different locations, and we are actively attending their vaccination events and coming and bringing things like vitamin C packs, electrolytes, Gatorade, sanitizers, PPE, hot and cold packs, Tylenol where we can, thermometers, things like that to support people when they're going and getting their vaccinations, and also having people on site to have resource information, not just about UHC, but like I said, sometimes people are just questioning, how do I get on Medicare? How do I recertify for this? Am I eligible for these things? So we're out there doing that. So if you do have any programs or any things that are happening, if some of you are setting up vaccination events and would like support, just someone to come out, set up a table and kind of help give out some of those items, we'd love to support and do that. We're starting programs with Wayne State University, so you might see us around a lot because they've got vaccination events everywhere. And then also as senior programs are starting to open up more, we're doing a lot of that. So that's why I was there, getting to do the fun stuff. I ate a couple of green donuts, but they were mostly for the seniors. And luckily almost everyone in the building there, luckily is fully vaccinated. And we've got about 50 people more that are getting their second dose in the next couple of weeks. So things are starting to open up more. If there are opportunities that you're looking for assistance as far as sponsorship or support for some of these community events, please contact me and please let me know. And then I'll go ahead and transfer over to Karen, who is much more educated on the health effects of the older adult population. So I'll let you take it away, Karen.
Hi, I'm Karen Valdivia. I am a senior clinical quality nurse with United Healthcare. I've been with United Health Group a little over 5 years now. My team is more provider facing. We support primary care providers across the state of Michigan just to ensure that our members are receiving the care and services that they need to stay as healthy as possible. And as I look at these discussion questions and how women's health has suffered during these times, I first just, you have to acknowledge that the last year has just been really challenging. And it really impacted women's health and access to care. Access to care is their opportunity to obtain timely healthcare services to preserve and improve their health. So as we watched COVID, become a healthcare crisis, and then these restrictions fall into place, there was like this resulting isolation that kind of caused us to deprioritize our wellness and delay some of those preventative care and services that we really need to have. Just to provide a little framework in comparing some healthcare data between year over year from like 2019 to 2020, face-to-face interaction with primary care providers declined by about 60% last year. About 65% fewer mammograms were completed for early detection of breast cancer. Things like for diabetes, I mean, a key standard in the prevention of complications from diabetes is getting a hemoglobin A1C blood test. And this measures the average level of blood sugar in an individual's blood over 3 months. We saw a 66% about that decline in diabetics completing that test. So you have to remember, and for women in particular, diabetes increases the risk of cardiovascular disease and heart attacks. And then, of course, we can't fail to mention that we've seen a decline in mental well-being, which further impacted women's health as this isolation, increased those feelings of anxiety and fear and depression. And as I look at some of the changes we've seen in the last year in the delivery of care, truly healthcare providers, I mean, the healthcare industry, we could say, was challenged to expand upon non-traditional methods of care delivery. And we did this through expanding telemedicine, connecting with patients by phone or virtually where there's a video monitor and they can see each other. We've expanded medication delivery methods such as mail to home or pharmacy curbside and drive-through services, as well as the drive-through clinics for COVID testing and vaccinations. A downside to this, I would say, though, is even though telemedicine allowed us to connect, it does have its limitations. So, for example, adequate blood pressure monitoring can be challenging, and this is really important in the prevention of strokes. And there's certain physical examinations that telehealth just really isn't the best option. Breast exams, pelvic exams would be good examples of that. And then I think anytime you're using a computer, people just have that privacy concern that might hinder some more open dialogue. So we have to be cognizant of that. And then I would just say the practice of medicine overall suffered the loss of some of the human touch aspects of caring for people. Because really, there's truly nothing, I mean, there's just something irreplaceable about meeting with your provider face to face. The stay-at-home lifestyle, I would, lifestyle and behavior changes after the stay-at-home orders went into effect, I would say there was both positive and negative changes. I mean, unfortunately for some, it increased, right, those feelings of anxiety and hopelessness. It caused undesirable changes in our diets, snacking out of boredom, missing that connection, sharing a meal with other people. For particularly the elderly population, a decrease in mobility, in energy level, in mood, even the motivation for self-care. But I would say on the positive side, for some, staying home reconnected families. It increased interactions in at-home activities, maybe walking together, going outside together, or conversations at the dinner table. So I think some of that, as many negative things as we think about for the last year, we need to acknowledge there was some positive too. In the conversation about COVID vaccine, the question was, has the upcoming COVID vaccine changed conversations? I mean, I would say particularly in older adults, that's become the hot topic. Did you get yours? Where did you get it? How did you get it? How did you sign up? What are the side effects? And we really are encouraging people, if you have not yet had the vaccine, become informed. Ask your provider as many questions as you may have. Visit like the CDC website, the Centers for Disease Control website. There's a lot of information there. Other resources might be, local health departments, chain pharmacies, hospitals. There's a lot of information out there, and I would just recommend becoming well-informed, excuse me, in making that decision to get the vaccination. An upcoming event that's, I think, is wonderful, that starts on March 23rd. Ford Field in Metro Detroit is hosting an all-day vaccination event, and I think it goes on for like a week. I can give you guys, give you guys the information for that, after this meeting, just to provide to folks. But you can go to the Ford Field website or the Michigan Department of Health and Human Services website, and there's information there about this event. My understanding is that they will vaccinate anyone over the age of 14, so it's open to a lot of people. They're not excluding anyone based on where you live in Michigan, so it sounds like it could be a great event. There's also the Michigan Department of Health and Human Services COVID hotline, and that's 888-535-6136. And again, I can send you this information after this call. And then lastly, I would just say, my 5 suggestions for optimal health right now. One would be, we're a year into this, we're starting vaccines. I would say call your doctor, make that appointment and keep that appointment. Ask them, what measures have you put into place to protect me, to keep me safe while I come in there to get services that I really need? Go to the doctor prepared. Take your list of medications with you. Take a list of questions or issues that you want addressed. And one thing I always say, include those questions that are keeping you awake at night. Those are the really important ones. Make your mental health a priority. And, basically all of us have touched on this during these conversations. Reach out to family and friends for some social interaction. Even if it's a Skype call or something like that. Seek local activities that might accommodate social distancing or virtual gatherings, or, there's online, some people have to do some online hobbies like quilt making or things like that. Just, trying to get yourself to reach out, seeking that social interaction. Humans were designed to be social. Fourth, I would say keep moving. Get out there and walk, participate in some senior safe exercise programs. Again, on the CDC website, there is information there on some physical activity regimens for older adults, and that would be a great place for our older population to look for some of those activities that would be safe for them. And then lastly, I would say utilize the many services that we offer to members of our health plan. Things like our house calls program, which allows you to see a healthcare provider in the privacy of your own home. Some of our at-home test kits for things like the blood sugar testing, like the hemoglobin A1C or colorectal cancer screenings. We have free home delivery of medications. We have free transportation services to help you, even like the event that's going to be at Ford Field would be a great time to say, hey, I need help with transportation to get there. And we offer a wealth of services to our dual special needs members, those with the Medicare and Medicaid.
Yeah.
And I guess lastly is just be kind to yourself and be kind to others. We're all in this together, and it's a very stressful time. So just be kind,
That's such a key point, Karen. And I just appreciate just the wealth of knowledge and just hearing about 65% fewer mammograms. That's just baffling, but it's what all of us have been dealing with, and just how preventative care has suffered through the pandemic. And so the effects that we'll be dealing with a lot of this for years to come is just overwhelming to think about, but great suggestions on how we can continue to get through this together. So thank you, Tabitha and Karen, so much for your time. I really appreciate it. And we're going to move quickly over to Megan because we have about 10 minutes left, and you can take that full 9 minutes. And if we can get to the Q&A, great. If we can't, then we'll get anyone connected at the end of the call. But we have Megan with us, Megan Kedian. She's the sole proprietor and health and wellness coach here in, I believe, Ann Arbor, Michigan. So glad that we were able to connect with her, and I'll look forward to hearing your perspective on everything.
Hi, thank you so much, Brianne. Can you hear me okay?
Sure can.
Okay, great. So I just wanted to say, first of all, thank you so much for having me. This is my first time on one of these calls, and I really appreciate the invitation. And I've already learned so much from you ladies. So thank you so much for everybody. That was great information to get from you all. And yes, my name is Megan Katan, and I am a wellness coach. I'm actually right next door to Ann Arbor. I'm here in Ypsilanti, Michigan. So I am focusing on a virtual setting. So it's really interesting for me to get all of your feedback about how people are experiencing the virtual setting for the first time. And what I like to focus on is all around wellness. So I really encourage people to not just think about moving and not just think about nutrition, but to also really dive into where is your mental health right now. So what I did was I went through the questions and just kind of prepared a couple little points that I wanted to touch on today. So if I look at my notes, please forgive me. But what I wanted to say was, I think that the biggest change that I've seen is women feeling like they don't have the time or the financial resources to focus on their own health and wellness. And I would say that the biggest thing is time. This whole everybody being isolated and everybody changing and going home, it's really created an imbalance between where your priorities lay. Because we used to get up in the morning and have a little bit of time for ourselves and maybe work on our fitness. And maybe we would, have meals prepared already. And then you had that separation between your home life and your work life. And now everything is all in one place. We're in the same place all the time. Our work life is on top of our home life. And we're prioritizing everybody else's needs, particularly women. And, forgive me for not remembering who exactly said it, but one of you mentioned that women tend to take on a caretaker role. And so, not taking care of yourself and thinking, oh, but no, I need to make sure that so-and-so has what she needs, or I need to make sure that my daughter has all the resources that she needs, or my son, or, for me in particular, I don't know about any of you, I've been worried about the neighbor across the street a lot because I know that she lives alone. So the biggest shift that I've seen there is women prioritizing everybody else, and then at the end of the day realizing that they didn't even take 5 minutes for themselves. So a big thing that I think is really helpful is educating women, especially in the elderly community, that even if you only have 10 minutes a day to do your reading that lifts you up, or do some stretching, or do something that's good for you, those 10 minutes are creating more and more value that's going to build up and impact you continually, and not just in that one day. And, I think that staying motivated to take that time for yourself is a really big issue as well. So finding the support that you need, and going along with educating women about taking the time, but educating people how to use the virtual settings, right? So I got in touch with Pandora through a virtual setting through LinkedIn. So if you're already in a virtual setting, then reach out to the people who you have contact with and educate them in how to use those things. Offer them a phone call, offer them a complimentary consultation. I do a lot of communicating through Instagram and like different messaging apps. And so really being aware of the fact that somebody may be on those virtual places for the first time. Make sure they know that, you know, it's a click of a link to get somewhere, or there's a phone number in a specific location or something like that, or that you have support groups available to them. Another big thing that I've seen is women feeling like they can't focus on their own fitness because they're maybe concerned about their joints or their ability to do something, or maybe they have an injury or something like that. So just encouraging women to take things slow and do what they can and go with their own pace and never feel like they have to be capable of doing a certain task. So if you can just say you're in an apartment community, if you can just walk around the building once, that's fine. If you're in a setting where you feel like your knees are aching and you don't want to do a lot of walking, or you don't want to use the exercise bike in your community, you can sit on the couch and do some stretches. If getting on the floor is uncomfortable for you, use your couch, use your bed, you know, use what you're comfortable with in your surroundings, and shifting that mindset to not feeling like I'm isolated, I can't go anywhere. Just stop and look at your surroundings and look at what you're already comfortable with in your own home and see how you can use those things in different ways. Walking up and down the stairs is a really great way to get moving and get your heart rate up, you know, because we've heard people today touching on, if you are already having an illness, if you're not moving enough, if you're not getting that circulation going, you could then cause another problem to happen, right? If you're not getting the circulation, your joints are not going to be as happy. If you're not getting the circulation, you could be talking about heart disease later on. So my top 5 suggestions, I went ahead and wrote down just some top 5, and other women have touched on this today, so I'm repeating a couple of things. But keeping moving, like I said, even if that means just a short walk or some stretches, that's so good for you. It does create endorphins, even if it's only 10 minutes, and those endorphins make you happy, right? And focusing on trying to find healthy foods. I know we've all liked the snacks and everything like that. I talk a lot in my platforms about if you're seeing a lot of people like eating raw food a lot, but that doesn't sit well with you, or it's not appetizing or something, then find something that is appetizing to you that's healthy. There are a lot of really easy ways to swap out foods that work for you better. You don't have to eat 100% healthy 100% of the time, you know, kind of follow the 80-20 rule. 80% of the time eat really well, 20% of the time have a treat. And finding support wherever you can, calling a friend, plugging into a community if you can find a support group. If you can't find a support group, contact some kind of a leader in the community who will be able to guide you to an area like that. And reading something positive every day to help you shift your mindset. If you can get either like the Kindle app, or if you can get the Amazon one, You can get some really good books. There are a lot of free applications for podcasts, and you can go and just listen to something positive every day. YouTube is free. Going on YouTube is just as simple as clicking at the very top of the screen and looking up, positive talks. And then just drinking enough water and getting enough sleep. I think that's been a big struggle. That was my last point, is making sure everybody gets enough sleep, but don't stay up too late watching TV.
Yeah, absolutely. And we're at the top of the hour. Just to thank Megan specifically for the point of educating women, educating ourselves even 10 minutes a day, and practicing self-care. That's key. As you guys know, it's my passion to end these meetings on time. So we're going to have a quick sign off here, but I want to thank all of our participants and all of our speakers today for jumping on. Thank you so much for all of the education today. It was a great meeting. And as I mentioned before, this is recorded, and I'll get it out to everyone just in case you want to review the information again. So thanks again, you guys. Thanks for all your resources, and I hope you have an amazing day.
And really quick, our next meeting is April 15th, and the title is Senior Volunteer and Community Services.
Awesome. Thanks, Pandora.
Thank you.
All right. Thanks, everyone. Have a great day.
Thank you.
Bye.
Bye-bye.